This season we have some wonderful new segments that are coming up, and this one is with Rancho Mirage Women's Health Center, two fabulous doctors, Dr. Lisa Lindley and Jeralyn Brossfield, with the Medical Minute. But before we get started, I want to ask you, open your mouth. I've always wanted to do this. Let's see. Okay, now what do you see when you look in there?
Well, it's really very practical, Patty. When you do that, it starts a reflex that opens up the back of the throat, so it makes it easier for us to see. So it's really very simple.
Oh, okay. Well, I've always wanted to do that. I bet all of you have too. Yay! Now, on a serious note, you're going to be giving us tips all season. So would you like to give us a tip today? Start us off?
Yes. I think Dr. Brossfield is going to tell us today how we can reduce our risk for breast cancer.
Fabulous.
That's right. You know, it seems that everyone we know has someone that they know with breast cancer. And in fact, I think we often worry that we'll be affected by this cancer. And the thing that's amazing, although 1 in 7 of us will be affected with this cancer, there are 3 things that we can affect that reduce our risk. In fact, the very top 3 risks for breast cancer are in our control. They are being 20 pounds or more overweight, not exercising daily, and drinking 2 or more alcoholic beverages each day. So, what can you do to lower your risk of breast cancer? You can lose weight, you can decrease your alcoholic consumption, and you can exercise every day. And in fact, you should make sure that you're up to date with your yearly breast exam and your mammogram. And if you do have a risk of family hereditary breast cancers, go ahead and ask your doctor about genetic counseling. But what can you do to lower your risk for breast cancer? You can lose weight, exercise daily, and decrease your consumption of alcohol. So for today, take a walk. It's a healthy habit. Dr. Lindley, there's been a lot of confusion about when women should have pap smears.
That's right, Dr. Brossfield. Many women have been told that they don't need to have a pap smear after reaching a certain age or after having a hysterectomy. What I'd like to clarify today is that a pap smear and a pelvic exam are not the same thing. In fact, a pap smear is only a small part of a woman's annual pelvic exam and physical exam. The pap smear is the part that screens for cervical cancer. The pelvic exam includes looking for lesions and feeling for masses in the lower abdomen or pelvis. Now, these lesions may be skin cancers, and the masses may arise from the bladder or the colon, as well as the female organs. So you can see how this is relevant for a woman at any age, even if she's had a hysterectomy. Now, these are not just my recommendations. These are the recommendations by the U.S. Preventive Services Task Force and the American College of Obstetricians and Gynecologists. They make it very clear that a woman should have a pelvic exam every year. Now, it may be appropriate for you to skip your pap smear on certain occasions, but this is a conversation you should have with your doctor at your annual pelvic exam, because every woman needs a pelvic exam every year. So what can you do? You can call your doctor and make sure you're up to date on all your screening, because that's a healthy habit.
Good morning, I'm Dr. Brossfield.
And I'm Dr. Lindley, and we do have a few healthy tips for the holidays. First of all, a little background information. Weight management is all about calories in and calories out. If you want to maintain a healthy weight, you have to balance your calories in and calories out. So think of your body as a calorie account, much like your bank account. During the holidays, it's easy to burn a few more, it's easy to consume a few extra calories one day. So if you consume a few extra calories at a party, you have to balance the account the next day by burning a few extra calories or eating a little less.
Another tip is to never go to a party hungry. Have a little snack before you go. Protein is great because it sticks with you, so a piece of lean meat, some cottage cheese, or a cup of soup will help you get through the party without indulging in quite as many of all the wonderful gifts and tasty things that we get at parties.
Another thing to watch out for is alcohol consumption, because there's always alcohol available at parties, and these are actually just empty calories and a lot of sugar. So if you want to avoid a few calories, instead of having a glass of wine, have a glass of sparkling water with a lime. It looks sociable, you're participating, but you're avoiding those unnecessary calories.
Another routine that you should maintain is eating 3 meals a day and exercising frequently. Maintaining your routines through the holidays will help you stay healthy and happy, and it's a healthy habit. Back to you, Patty.